All right, let's dive right into this explainer. Today, we're uncovering a seriously stealthy health threat that, honestly, might just be linked to your favorite weekend habits. You know how it is, we all have our routines to unwind. Maybe it's grabbing a few drinks with friends or hitting up that late night spot for a bowl of piping hot noodles. But what if I told you those seemingly totally normal habits were quietly setting the stage for a major medical condition? Today, we're unpacking the facts around esophageal cancer, and we're going to break down some incredible medical insights from Dr. Tetsuya Isero, a top expert who literally treats tens of thousands of patients every single year. 35 times. Just think about that number for a second. Could your standard Friday night routine, drinks, maybe a cigarette, and a bowl of extra spicy ramen, actually be putting you at a massive 35 times higher risk for a deadly disease? Look, I know it sounds almost impossible, but the clinical data is staring us right in the face. We're going to explore exactly how certain combinations of these everyday habits create a perfect storm inside your body. And much more importantly, how you can spot the earliest, most bizarre warning signs before things get out of hand. Okay, part 1, understanding esophageal cancer. To really get a grip on how to protect ourselves, we first need to look at what we're actually dealing with anatomically. So your esophagus is basically a 25-centimeter long tube. Think of it as the main highway connecting your throat straight down to your stomach. It's a pretty simple hollow organ, but the scary part is that deadly cancers can form right there on its inner surface. And what's really startling here is who this cancer tends to target. The data shows us that men are actually 6 times more likely to develop cancer here than women. 6 times. It's a highly lethal condition if you just ignore it, leading to roughly 11,000 deaths a year just in Japan alone, which is where Dr. Istero's data is focused. But hey, here's the absolute most crucial part of that statistic. These deaths are largely preventable. Now, there is a massive, undeniable contrast in survival rates here. This is definitely not one of those diseases where your fate is sealed on day one. Check this out. If you catch esophageal cancer in its early stages, the 5-year survival rate is a very reassuring 75%. Treating it early usually just means a simple, minimally invasive procedure where the doctor basically goes in with a scope and scoops the cancer right off the surface. Super straightforward. But if you wait until the cancer advances, that survival rate completely plummets to 20%. And the treatment? It turns into a major open chest and open abdomen surgery just to physically remove parts of the organ. Time is literally everything here.
Moving on to Section 2, the massive risk multiplier.
So, you might be wondering, why do some people get this while others don't? Well, the lifestyle factors are where this hits really close to home. Look, we all know smoking is bad news, and throwing back too much alcohol isn't great for you either. Obviously, each of these on its own bumps up your risk of esophageal cancer. But when you combine them, oh boy. The danger doesn't just add up, it multiplies exponentially. When someone is both a regular smoker and a regular drinker, their risk skyrockets by that astonishing 35 times we talked about, compared to someone who does neither. It's a terrifying multiplier effect. Why? Because the alcohol basically acts like a solvent, literally helping the toxic carcinogens from the tobacco penetrate incredibly deeply into the lining of your esophagus. And that actually brings us to another major risk factor, which you've probably heard called the Asian flush. Dr. Isero points out something fascinating here. If your face turns red when you drink alcohol, it means your body is actually struggling to properly break down that alcohol. Your liver just isn't processing it efficiently, which causes these toxic byproducts to just build up in your bloodstream. And guess what? Those built-up toxins relentlessly attack the cells lining your esophagus. So if you're someone who gets a red face from just a single beer, and you also happen to smoke, you are in the absolute highest risk category. But wait, it's not just about what you drink and smoke. It's also about what you eat. And to all my spicy food lovers out there, I am so sorry, but you need to hear this. Consuming extremely hot and spicy foods, picture a boiling hot, extra spicy bowl of ramen, that actually actively damages the delicate lining of your esophagus. The physical heat literally burns your cells, while the intense spices irritate the heck out of them. And if you make a habit of washing down scalding spicy foods with alcohol, you're basically creating a highly dangerous inflammatory environment right in your throat. And that is exactly where cancer thrives. All right, Section 3, 5 silent warning signs. The absolute most crucial point of this whole explainer is knowing what to look out for. Because remember, catching it early is what keeps you in that 75% survival bracket. So let's count down 5 bizarre yet highly specific early symptoms that you should absolutely never ignore. Okay, symptom number 1 is very distinct. If you swallow a hot liquid, like tea or hot soup, and you instantly feel a sharp, stinging sensation right in the middle of your chest, pay close attention to that. Dr. Isero notes that patients with esophageal cancer report this exact feeling all the time. Now, I want to be super clear. This is very different from your standard acid reflux. Acid reflux usually gives you, burping, general heartburn, maybe a sour taste, but a localized stinging pain specifically triggered by swallowing something hot, that's a massive red flag that a lesion might be forming on your esophageal wall. Then we have symptom number 2, a prickling, almost tingling discomfort right in your chest. Now, what sets this apart from the first symptom is that this prickling happens even when you aren't swallowing anything at all. You could literally just be sitting there on the couch watching TV, and you feel this strange, persistent prickling deep inside. That's a sign that a tumor might be actively growing and physically irritating the surrounding tissue of the esophagus all on its own. Moving right along to symptom number 3, and that's the sensation that food just feels stuck in your throat or your chest. Remember earlier when we said the esophagus is a 25-centimeter long tube? Well, if a tumor starts growing on the inside of that tube, it naturally narrows the passageway. Makes sense, right? So if you find that totally normal bites of food, stuff you used to swallow with zero problems just a month ago, are suddenly feeling like they're getting caught or delayed on the way down, it means the cancer has probably grown enough to physically block the tube. Symptom number 4 sounds completely unrelated at first, but honestly, it makes perfect anatomical sense once you see it. It's a hoarse voice. Running directly right alongside your esophagus is the recurrent laryngeal nerve, and that nerve controls your vocal cords. So if an esophageal tumor starts to expand outward, it can actually press right up against and pinch that vocal cord nerve, meaning if you have a hoarse, raspy voice that just won't go away after a week or two, and you know for a fact you don't have a cold, it might not be a throat issue at all. It could very well be an esophageal tumor pinching that nerve.
Finally, we have symptom number 5, unexplained back or chest pain. Look, as we get older, we all get random aches and pains, right? So how do you actually know if it's serious? Well, Dr. Isero teaches a brilliant little trick to tell the difference. If it's just a pulled muscle, the pain is going to change depending on your posture or your movement. It hurts when you twist, but it completely stops when you sit still. But internal pain caused by a tumor invading surrounding nerves, that is a constant, unrelenting ache. It literally does not matter if you stretch, lie down, or stand on your head, that dull ache in your chest or back remains exactly the same. That right there is internal nerve invasion, and it means you need medical attention immediately.
Section 4, the right way to test. Okay, now that we know all the terrifying signs to watch out for, let's talk about the hero of our story, the solution and how to actually detect it the right way. When you go in to check your upper digestive tract at a health screening, you usually get 2 choices: drinking that chalky barium liquid for an x-ray or getting an endoscopy, which is the camera down the throat. Dr. Isero definitively states that when it comes to esophageal cancer, those barium x-rays are virtually useless for catching the disease in its crucial early stages. They just frequently miss the small, flat lesions. The endoscopy, the camera, is literally the only correct choice here. Why? Because it directly visualizes the tissue in high definition, and get this, the doctor can even treat the early cancer right then and there. You might actually hear an endoscopy called a stomach camera, which I know confuses a lot of people. They think, well, hold on, I want to check my esophagus, not just my stomach. Let's just demystify that right now with a very simple anatomical fact. To get down to your stomach, the endoscope has to physically travel all the way down your 25-centimeter esophagus first. And doctors don't just close their eyes on the way down, right? They carefully inspect every single millimeter of the esophageal wall before they ever even reach the stomach. Now, I know exactly what you're thinking. Having a camera shoved down your throat sounds absolutely awful. But Dr. Isero has a very, very clear recommendation for this. Just get the camera with anesthesia. Seriously, there is absolutely no need to be a hero and do this while you're awake. By opting for light anesthesia, you are completely asleep and relaxed. And not only does that make the whole process completely painless for you, but it actually helps the doctor do a significantly better job. Think about it. Finding early-stage esophageal cancer requires incredible precision. If a patient is awake, gagging, and choking, the doctor's view is totally compromised. A relaxed, sleeping patient gives the doctor the time and the stillness they need to spot those tiny, life-threatening anomalies. Plus, honestly, you get a pretty great nap out of it. And finally, Section 5, early detection saves lives. Let's bring this all back to the real stakes here. This explainer isn't just about throwing scary medical facts at you, it's about empowering you. Remember that massive 75% survival rate we talked about at the very beginning? You only get those odds if you act proactively.
If you have any of those risk factors we went over, if you smoke, if you drink and get that red face, if you absolutely love scalding spicy food, you need to be incredibly vigilant. So I want to leave you with one final provocative question. When was your very last endoscopy? Seriously, if you are experiencing any of those 5 silent warning signs, the stinging, the prickling, the hoarse voice, the constant ache in your back, or if your food is feeling stuck, do not put off your health checkup. Call your doctor, schedule an endoscopy with anesthesia. Catching this hidden threat early isn't just a good idea. It's literally the difference between a simple outpatient procedure and the fight of your life. Take control of your health today. Thanks for joining me for this explainer, and we'll see you next time.